I am very pleased to have with us today Dr. David Sugarbaker at the offices of Barron & Budd. Dr. Sugarbaker is a professor of surgery at Harvard Medical School. Dr. Sugarbaker, you are doing such great work in the area of mesothelioma and treating patients with this horrible disease. How did you get involved in that area of practice to begin with?
You know, it's very interesting. It was one of those things that just sort of was laid in my path as a problem that needed to be solved. I had finished my training at the University of Toronto and was asked to come back to the Brigham and Women's Hospital and to start a new division of thoracic surgery, exclusive of cardiac surgery. And I think being the new kid in town, so to speak, I had a lot of patients referred to me from the New England area, from the shipyards, and a lot of Navy people, patients with backgrounds of asbestos exposure from a variety of sort of the maritime exposures. And many times I was a second or third physician that they'd seen, and there was nothing to be done for them. And so I began getting interested in the problem. What could we do for these patients? There was a medical oncologist at the Dana-Farber who was also interested primarily in peritoneal mesothelioma. And actually, I have to credit, or I should say, my father is somewhat responsible. He was a surgeon, and I was talking to him about this particular problem. Nothing can be done. And he said, "Dave, you're a surgeon. Why don't you figure out the first step, which is to remove the tumor that can be seen from the patient?" Step one. Step two, he said, maybe longer and a longer road, which is to kill the remaining cells that can't be seen. So the first part of the effort has been to make removing the tumor a safe and viable alternative for some patients with mesothelioma.
For someone that may have just been diagnosed with mesothelioma that may be viewing this, what advice would you give them?
Well, I would tell them what I tell patients who we are assessing within the International Mesothelioma Program, and that is, already you've done the most important thing. You've sought out a center, a medical center, that has a published track record in the treatment of mesothelioma. I think whether you're utilizing your family physician or your local oncologist, family or friends, you want to, first of all, go to a center and allow yourself to be assessed and follow through with the treatment.
What's the most exciting new procedure in your practice?
It would be the addition of chemotherapy wash at the time of surgical removal of the tumor. Mesothelioma is unique. When it comes back locally. It comes back in the bed or in the tissues where we had removed it the first time. So those cells get into the normal tissues and hide there. And I think the most exciting new approach is the addition of chemotherapy at the time of surgery to both the abdomen as well as the chest where the tumor was removed. And with that, we've seen a steady increase in our average survival. And our average survival, depending upon the stage and the cohort, can be as high as, an average of 52 months for certain patients. That'd be an average survival. And the other survivals would be depending upon the treatment strategy and the type of tumor. There's a lot of variables, so it's hard to just sort of say this is the survival. But we've seen substantial improvements in the type of treatment we can give to patients and their response to it, such that most patients now can get good treatment and can see, for the majority of patients, there was significant life extension with treatment.
Back in 1989, when you started this program, what was the average survival for a person diagnosed with mesothelioma?
Anywhere from 6 to 9 months, in that range. So there's been, for cohorts, now selected patients, meaning certain cell types, there's been substantial improvement, such that now we are able to offer treatment to most patients. And lest people think that the IMP is strictly surgical, we have a very strong medical oncology arm, radiation oncology arm, and many times those strategies are developed when the patient comes to the IMP, but then are implemented back home. in close cooperation with their treating oncologist at their home hospital. And that really is the best of both for those patients. And many times the treatments that we offer entail surgery followed by other treatments, and we would usually arrange those other treatments back home, because that's where everybody's most comfortable and at their strongest is in their home environment.
Doctor, I know that there are a number of people in my profession that handle cases involving mesothelioma, and they may be wondering, what can they do to help this program?
Well, Russell, the International Mesothelioma Program is a focused scientific effort made up of a multiple of scientific laboratories that are focused on finding more effective treatments in mesothelioma. That takes money to support, and you were one of the earliest supporters of the IMP, helping us to get off the ground. We're very grateful for that, and certainly, you know, some of the biggest scourges that we've come through as a nation, polio, for instance, the cure for polio, the vaccine, was completely financed through private funds. That answer was found with private money. And we're looking for the same sort of solution here and need the help of your colleagues to speed us along the way.
Thank you, Don.
Thank you, Russell.